Hey ladies, are you struggling with PMS around your time of the month? Well, here's 3 supplements that can help coming from me, a pharmacologist trained in natural supplements. The first supplement I want to talk about is gamma-linolenic acid, also called GLA. GLA is an omega-6 fatty acid that can be found in things like borage seed oil, primrose oil, and black currant seed oil. Now, you hear omega-6, you may be afraid, but this actually gets converted into DGLA. DGLA is anti-inflammatory. And one of the great things about DGLA is that this is then used to make something called PGE1. Now, PGE1, this is a type of prostaglandin. And what this PGE1 does is that it helps relax smooth muscle cells. So that can help immensely with your cramping. Now, another really interesting thing around this DGLA is that what this does is that this actually blocks the COX enzyme and it blocks the LOX enzymes. So these are 2 enzymes that drive inflammation in the body. And these have been directly shown to drive PMS pain and irritability. Now, the second supplement I want to talk about is pycnogenol. Now, first off, pycnogenol also actually blocks these COX and LOX enzymes similar to GLA, or rather DGLA. But what pycnogenol also does is that it boosts something called nitric oxide, also called NO, in the body. And what this can do is that you have your blood vessels here. It can help make them wider. NO helps open up these blood vessels. This can help you with blood flow and deliver oxygen to your uterus as well as your brain because it crosses the blood-brain barrier as well with antioxidant support to help improve your mood. And another cool thing about pycnogenol is that pycnogenol helps lower histamine levels in the body, and histamine can drive estrogen and vice versa, which can contribute to PMS symptoms. And what's really cool is that pycnogenol has been shown in clinical studies with women to help with not only every symptom of PMS that they assess, but also help with the transition in and throughout menopause. And now the third supplement I want to talk about is chasteberry, also called chastity berry, also called Vitex. Now, what this functions as, this is a pretty interesting mechanism. So if we have our cells here and we have a receptor here, this is your dopamine 2 receptor. And what this does here, you have the chastity berry. It actually helps bind and stimulate this receptor. And how this really helps is that when you have more dopamine, you also end up having less prolactin. And prolactin can be elevated around your time of the month. And this prolactin is often elevated in women that experience significant PMS. And to go one step further, this prolactin also plays a role with progesterone. So normally, if you're having too much of this prolactin, that can result in lower progesterone and contribute to issues. However, with the chastity berry here, we get more dopamine, less prolactin, and that can mean we have more progesterone. Now, of course, every woman is unique and there's no one set magic bullet for every single woman's PMS, but these act on some pretty major players in PMS.